everybody, Jeremy Sutton here with Healthy SBC Podcast. I'm here with Vickers and Stacy Carpenter, who are craniosacral therapists, and we're going to be talking about craniosacral therapy, what it is, who it's for, and how it can make you healthier and happier. So, ladies, thank y'all for joining me on the podcast.
We're happy to be here.
Yes, thank you for having us.
Wonderful, wonderful. I would just like for y'all to introduce who you are and why you're doing craniosacral therapy, and Ann, you can go first.
Okay. I'm Ann Vickers, and about 30 years ago, I had moved to Shreveport, was a speech therapist at Shreveport Medical Center, and I took a vaccination they asked me to take, and within a few weeks, my hands quit working. And at the time, I didn't understand it had anything to do with inflammation, but I went through about a year and a half of couldn't use my hands. And so they eventually took out some muscles of my neck and a rib, thinking that would unpinch the nerve, and it didn't work. So the PT at that point sent me to this wacko PT who did this wacko therapy called craniosacral therapy, and I began to get better immediately.
Wow.
And I said, I have to learn how to do this. And so I went and trained with John Barnes, who does some myofascial work, and there's a touch of craniosacral therapy in there. That's who my PT had been trained by. But he said, I think you should do this upledger course. He's the guy that made it up. So once I started taking the upledger courses, 3 to 5 classes a year, I was hooked, and I never looked back. And I did have to go back to speech therapy periodically until the craniosacral paid the bills, but then it's been in private practice ever since.
Wow. So you've been doing this about 30 years?
Yeah. So
That's amazing.
Yeah, 28 years, 96.
Who was the wacky therapist?
His name was Doug Tejan, and he had a private practice here in town. His brother's still around, but I think he's retired now.
Wonderful.
And Doug was my mentor, and as well as my therapist. So.
The wacky therapists are the best.
Yes.
I love it.
Yes.
That's a great story. I love that you had that experience and then it drove you into doing that.
Yes, I couldn't go back. And I went to massage school in there somewhere to get more license to touch more people. And I remember my dad being mad. He said, I've paid for you to have a graduate school degree, and then you go do something you just need a GED to do. And then I worked on him, and he said, wow.
Yeah.
And there was never a complaint after that. And I think his money was well spent.
Absolutely.
So.
I love it. I love it. And Stacy?
Well, 16 years ago, I was pregnant with my third kid, and I heard about craniosacral therapy on a mommy group on Yahoo, and said, what the heck is that? So I looked it up, and I found Dr. Upledger's book, Your Inner Physician in You, and I read it. And when I got to the part near the end about him working on kids with learning disabilities, ADHD and autism, and it helping them, I burst into tears. And at that point, I didn't even know that my family was neurodivergent. I just knew that it was beautiful. And I heard a voice in my head say, you need to do this. And I thought, wow, I have a master's degree in math, and I am momming these little kids. How am I going to do this? And I looked into it and decided I really can't go to massage therapy school right now. So I said a little prayer, God, if this is really what you want me to do, will you please bring it back to me when the time is right? And fast forward to about 2 years ago, I brought my daughter here to see Ann for microcurrent neurofeedback. And I saw this poster on the wall, and it just reminded me, man, I wanted to do this at one point. And I said that out loud, just thinking to myself out loud. And she said, well, you should do it. I'll mentor you. And so here we are. I graduated from massage therapy school in January and opened my business in March.
Sweet. I love that. What I love in y'all's story so far is someone mentored you, and you did this, and now you mentored Stacy, and now she's doing this, and probably you're going to end up mentoring somebody at some point. So,
God willing, yes.
Yeah, it's all about connecting with other people and being open to serving other people. So I love that.
Yeah.
Congratulations. Well, tell us what is craniosacral therapy, because I'm going to be honest with you. When I was in PT school, the wacko thing came out. Hey, you're going to hear about this. It doesn't do anything, and don't do it. So, but I know that's not the truth. So you tell me.
So when I was as a patient at Doug Tejan's, the school here at Allied Health would bring the students over there to witness the voodoo, and they would all come back with the stories. But as far as I know, none of them ever went into it, except for one, and she's been practicing for about 15 years, and she was a tech for Doug, and that's when she first was interested in it. But then she did all her PT life, and when she retired in PT, she came back and started doing the classes, and I mentored her with that with Cheryl. So craniosacral therapy looks at the whole body, so not at the hip or not at the shoulder.
Right.
It's in the manual, you'll say it's a gentle hands-on manual therapy, but what we're looking at is the craniosacral system. So the craniosacral system includes the meninges in the brain down through the spinal cord, and the meninges touch the skull. The meninges also touch the brain, and the dural tube, which is the outer meninge, has most of the cerebrospinal fluid, and so there is a rhythm when the body produces and reabsorbs that spinal fluid, and therefore it changes the fascial system all the way down the body. So we learn to feel this rhythm as if you would feel the respiratory or the heartbeat, and it's different. And so once you learn how to feel it, you can tell where in the body the rhythm is not the same as on the right or the left, or one smaller rhythm on the right compared to the left. And then we know where to work based on that. And it's very light touch, so not the weight of a nickel, although the body can draw you in and you just follow the body. So it's really the body's beat.
Wow.
Would you say anything extra to that?
I would say that it is very patient-led. You know, if you're doing therapy, or if I'm giving someone a deep tissue massage, I am doing the driving. I'm deciding this is how deep I'm putting my thumbs, this is where I'm working. But craniosacral therapy is beautiful to me because we're listening to the client's body and working where they need with the depth and the pressure that they need.
Yeah, I like that. You know, so as therapists, we think we know what the person needs, right? Like you make a plan.
Yeah.
Like we call it a plan of care in PT, and then you follow that plan of care. But does the patient or the client, are they getting value from it? And so I love that that you're saying it's patient led, because if you don't think I did anything good, it doesn't matter what I think or what my book says. You didn't get anything out of it. So I love that.
And oftentimes the symptom is not where the issue is.
Sure.
So if you hear the patient, you listen to the body. And there's the science part of that, but there's also the wahoo part, which is sometimes the body is stuck in that spot because something happened emotionally, or when that physical problem happened, there was an emotional response too. So we have this whole part of craniosacral therapy called somato-emotional release. And the body, we teach the client to listen to the body, and sometimes there's expression of emotion or a memory that needs to come out, and then that body part quits having issues.
Love that. Yeah, I think I've talked to Clint Davis about that some. Like, at what point was it physical, emotional, spiritual? Like, we don't know where this all started.
Right.
But we know something is, like in the PT world, we know that you can manipulate the joint, you know, or spinal mobilization or adjustments, as chiropractors call it, and that can cause the muscle pain, or it could be the muscle itself, or it could be some muscles have capsules around them, especially in the spine. Maybe it's the capsule. So who knows? Let's try to treat all three and see. So emotional, spiritual, physical. I love that, because we all have those aspects.
And then the nervous system changes when you hear the body. Just like a child, if you hear that child, he quits having a fit. If you hear the body, it will tell you.
Yeah.
It doesn't want to be hurt. It doesn't want to hurt.
Right.
It doesn't want to be stuck.
It doesn't want to be the enemy either.
Right.
Oh yeah.
Yeah. Ooh, that's good. That
Really good.
It might be the name of the podcast. Your body's not your enemy. I like that. You know, so I've been a PT for 15 years. So we learned to hate chiropractors. We learned that craniosacral was crazy.
Yeah.
We learned all these things that it took me, some of those things it took me a year or two to realize were not the truth.
Yeah.
But mainly because we're just all after the same type of client, right? But the more I live, and I've been a PT for 15 years now, the more I understand that we all have value. So acupuncturists, chiropractors, massage therapists, craniosacral, all this stuff has value, because we're not just physical. And I think a lot of it goes back to, did I think it helped me or not? And if I think yes, then it did.
That's good.
But we have to listen to our body. I love that you pointed that out. So talk about the mechanism as how does craniosacral therapy work? Maybe we don't have to go through all the science, but you know, how does it work for, you know, Jeremy who doesn't know anything about it?
Meaning, if you're the client on the table.
Yeah. How does it help me feel better or get me where I want to be?
Well, I would say the first thing is your nervous system begins to down-regulate, and because you're not having to race anymore. And then once you realize it's not as wacky as I thought it was going to be, then you begin to feel, and we help the client feel it. find where my hands are, and then notice what's happening in your structures. You don't have to know the anatomy, but just be there with me. Be present with your body, and then you start feeling the binding begin to release. And some people feel more than others. You might say, how do you feel? And they might say normal. But then another one might say, oh, I can feel my left toe. As your hand's on my chest, I can feel my left toe
Right.
loosening up. So is that what you're asking? Or?
Yeah, I like that. I mean, no, I think that wasn't exactly what I was asking, but no, I like your explanation. As far as like, I guess on a, not a cellular level, but just like, what is that doing to the body when you're doing your treatment?
Well, if you think the body is a whole network, so
Mhm.
when we think of fascia, it's like super highways everywhere,
Yeah.
like in space age cars,
Yeah.
flying through the super highways in the dark. And so to me, that's an electrical system because it's, the dendrites, and
Yeah.
I just see it going all the way through the body, and what I'm doing up here is definitely affecting the rest.
Right.
And then once we get the vagus nerve to come back online, the body can start self-healing because
Gotcha.
it's a self-heal. It wants to heal because it's not the enemy.
Yeah, I like that.
It needs permission.
Yes. And that fascia, like it can be guarded because you injured yourself or because you had an emotional injury.
Right.
And between my hands, with the heat of my hands, it'll start to soften. If you just hang out there and support it.
Literally softens. So physically, you're seeing a change in the tissue,
Okay. I love that.
but with light weight instead of the force.
Sure. No, I like that. I like how you bring attention to, hey, here's my hands. You don't need to know the anatomy of this, but do you feel where my hands are? And that starts to bring body awareness back.
And what
Because
you
we
feel
check
between
out.
them. Yeah.
Right. We check out in this world. We get overwhelmed and we check out, and we go do fight or flight, and we never see how that affects us, and we overcommit and then are exhausted. And we go, how did I get here?
Right.
And when we can learn to come back into the body, then we may not have to keep going back to that same road and going, how did I get here again? How did I get here?
Right. No, so personally, I believe that I trained myself for years to just have fight, no flight, which is not good. Like I don't want to fight anybody, but I felt like that in my system, and I've had to go to counseling and do other things to calm that down, and thankfully it has. But I just remember thinking, like, I don't have flight. Like, there's never been a time I ran. Like, I'm just like, I'm going. Yeah, it's not good.
And people like that tend to have low back pain. I mean,
Yeah.
that's some of the psycho
Right.
is because you're like this all the
Yeah.
time. You're in that green light. I'm going.
Yeah, you're just looking for something to cause you to fight.
So the physical manifestation would that be a tight low back.
Yeah.
The chest is out and heavy forward.
Absolutely. No, that's perfect. I mean, and it makes sense posturally too from
Or
a
the
biomechanical. Yeah, you're just here and you're like, oh, I don't want back tight. Because I'm trying to fight everybody all the time, idiot. So that's why. No, I love that. So, what things does craniosacral therapy help? Like what diagnosis? Who's like the ideal person or the problem? If
Well,
there's
we have to stay in our scope.
Uh-huh.
So in the craniosacral world, we say it cures whatever ails you. But in our scope of practice, we'll see headaches and tension, low back pain, I mean all kind of back pains, neck pains. But we work with ADHD kiddos, and we work with people who don't sleep, and
People with anxiety,
TMJ.
people with depression, PTSD.
Sure.
TMJ.
TMJ. So it works great for TMJ.
I work with a lot of babies after birth. They can't suck for whatever reason. Sometimes coming out's pretty tough on them.
Right.
A lot of C-section babies have a lot of issues for various reasons, but they have trouble with the suck, or they are colicky, or reflux, and so a baby that gets treated when they're young may not have those issues later. Right? They may not have ADHD because things aren't so jammed in their cranial base.
Right. 11 and a half years ago, we showed it on you because we had a colicky baby.
It's a miracle with the babies.
That's awesome.
They're so fast to get better.
Yeah.
I can't wait to take that class next year.
What's your favorite person to treat?
Let me tell you, my favorite these days are babies.
Okay.
Just because babies just get better. All of us older people have a reason we're kind of stuck.
Yeah.
But the majority of people I treat are women between 40 and 65, let's say. And just because our kids are kind of growing up, and we go, I feel like crap.
Yeah.
And then they start being able to do something about it. There's finally time in their life where they can pay attention. But then again, I love working with young mothers because they're in the heat of I can't make this, I can't do it.
Right.
And so if they can learn those techniques early on, then maybe they don't have to get to the 65-year-old who's depleted.
Yeah.
I too love working on the moms. You know, I was such a go mom in my younger years and never took time for myself, and now I'm paying for it. And so I love it when I can catch the moms and say, hey, why don't you come, you know, just take 1 hour for yourself this week and come lay on my table and let me help you relax your shoulders and breathe deeply, and then they walk away and they're recharged and they are more present for their families, and I love it. I also love teenagers. Like, my heart is just with the teens. I love working on teens. They're not quite as easy to work on as the babies, I think, but they are a lot easier and fix faster than the adults.
Yeah.
And teenagers, like, they don't want to be here when their mom makes them come, but then they don't want to stop. They don't want to tell mama they got better because they just love it so much.
No, I love it. You know, teenagers are absolutely not my favorite, but it's, I didn't say that. I'll edit that out. No,
Yeah.
But when I have treated teenagers in the past, it almost, you get to be like a big brother to them,
Yes.
and I have seen that. Like, well, why don't I come anymore? I'm like, well, you're better. Well, I kind of like coming because they're getting that attention that they may not be getting. Something I noticed this week, I was in someone's house, and it was a grandson who I've seen many times at their house, and he hugged me when I left. And I was talking to my wife, and I wouldn't have thought about it, but several years later, there was a kid that I knew wasn't getting any attention. This distant family, but like, he ended up, like, I held him for like an hour one day, like, just because he crawled up in my lap and started hugging me. Yeah, and so I cried afterwards, by the way. But
I like it.
But I see this kid this last week, and I called my wife and I said, hey, I can always tell when a kid's not getting attention, especially from a man. It's like when they come and they hug me and they want to do that, and I'm like, and which is fine with me because I love kids. I have no idea where I was going with this conversation, but like, just seeing that and getting that attention, you know that people don't get that. And so with moms, like, when I had my other business, I only marketed to women over 50. One, because my mom she's now 60, but like, I wanted to take care of my mom and the women that were my mom's age. And so I only marketed those women. And I remember somebody saying, well, is that going to hurt your business? I'm like, no, because I remember I had one woman and I counted like 13 different people I had seen in her family just because I treated her well. You know, because that's what happens. Because really,
And
you
then
think
her
about
mouth
it.
tells
You
everything.
think about when I go home today, I don't care what I wear. I'm wearing scrubs. I got a hole in my knee because I need some new scrubs. My wife's going to say, hey, we're going to this thing. This is what you need to wear. Okay. Hey, we're going to, I think I want to start using this person. I go to the dentist that my wife has used for 20 years.
Yes, you do.
I, go to the church. I was going to the church that my wife had been a member at for 10 years. Like, women typically steer our decisions in the home. And so, which is why I marketed to 50-year-old women then too. But another thing is, like you said, mothers don't take care of themselves because they're serving everyone else. Cheryl, when I interviewed Cheryl Zai years ago, I think that was the whole premise behind our episode was you can't serve from an empty cup.
Amen.
And I know Lisa Arndale, who's in town, who works with perimenopausal women, she talks about that a lot as well. But my mom, I remember she would go to the store, whatever the store was when I was in the 80s and 90s, Walmart probably, and she would come back with something for me, something for my sister, something for my dad, but she never had anything for herself. And so she taught me how to be selfless and how to serve people, whereas my dad taught me how to work hard. But that's just typically, moms don't take care of themselves. So most of the people that I have treated so far in my concierge practice have been moms that weren't taking care of themselves. So that's just what it is.
I was just thinking, what really gets me going though is I like to see people that nobody else has been able to help.
Yes.
So especially neurologically, and probably that's from my speech therapy days. I work with head injured folks and strokes, but you can have that at any age. And so I really, like if I'm overstressed with too many clients and someone calls and has somebody that was in a car wreck or something, I'm just like, okay, I gotta see them.
Yeah.
Because it's wonderful to watch the brain. I love the brain.
Right.
The brain is mine.
So I love that you brought that up because I think PTs, massage therapists, any person who gets into that kind of profession did it to help people, right?
Yeah.
But I think sometimes the medical system, which we won't start talking about because it'll be 4 days, but it doesn't lend itself for us to truly help people in most settings. And so when you do something like this, when you have an office at your house, or you do concierge, or you get in a doctor's office that truly wants to take care of people, then you have more time. And I don't think it means that I'm a better therapist than somebody else. It just means that the model I'm using helps me help you better
I love that.
because I can spend more time, which
Yeah.
is why I
It
want to do
takes time.
counseling. Yeah, because it takes time. Because if you're seeing 27 people, the most people I've ever seen in one day is 26, and I felt horrible. I felt like I did the best I could, but nobody got great care. I felt bad at the end of the day, and I didn't want to do PT ever again. And so
Burned out.
you can't. But I know there's people that do that all day, every day, and that's the model they have. It's just like orthopedic surgeons, doctors, whatever. So I love that you bring that up. I love helping people that haven't been helped too, because then you look like a genius.
Yeah, I'm
But
a genius.
I'm sure he's a great scout. No, I'm just kind of like this redneck from nowhere, Louisiana. Let's talk about are there any contraindications of getting craniosacral therapy? Is there any adverse effects? I mean, I know there is for everything, but what is?
The main thing would be a brain bleed. If your brain's bleeding or you're having intracranial pressure, your cerebrospinal fluid might be leaking or something. That would be a contraindication.
Okay.
So wait till they're safe. So I've had plenty of stroke patients. We just wait some time.
Yeah.
Wait till they're stable and it's good. Concussion, you might want to wait a bit.
Yeah. Okay. Cool. What you got?
No, she pretty much covered it.
Yeah, and that's it. I mean, everybody else is very bad.
Everybody else, come on in. What? So, how can people reach out to you and you reach out to you, Stacy, and say, "Hey, this sounds great. I want to be a client." How do they get in touch with you?
Well, I have a website, iahp.com/pbwy for peace be with you.
Okay.
And I can give you my phone number. You can post that on your website, and they can shoot me a text.
Okay, perfect. You want to give it right now?
Sure, if I remember it. It's 318-464-5148.
Perfect. I'll put that in the show notes as well.
Thank you.
Awesome. What about you, Ann?
You can text me 347-8401, and I also have a Facebook page called Optimal Health.
Optimal Health. Perfect. Okay, I like to give people the last minute or so to talk about whatever they want, personal, professional. I don't care. If you got something on your heart, tell me.
Well, let's just throw this out there.
Okay.
And I think Stacy's the same for me as I am. But the reason we do this is because it's a calling from God. We both really believe that, and we do have a heart to help people. And so I treat lots of people who have no belief in God, but even they get better. And so when there's somebody who loves the Lord that's on the table that's suffering, and God can come in that in this treatment table with us. I mean, it's not about me being blessed, but boy, we're both transformed. So the work speaks for itself, and then inviting God in just makes it magical. Is not the word because doesn't go with that.
Yeah,
but it's
very
that,
holy.
It's
It's holy.
It's holy.
Yeah.
That's
I come away from this with more energy than I go into it.
That's it.
Awesome. Love that.
I also want to say, when I was in my discernment period after Ann said, you should do this, and I was thinking about it and trying to figure out how I have this kid attached to me 24/7, how do I go to school and not break her? I came here for a few sessions, and I had back pain, lower back pain for 20 years, probably from falling on my tailbone on the ice in Wyoming, and maybe a little bit from a bike crash I had when I was 11. And after the first session with Ann, it was 60% better, and after the second session, I've never had it since.
Awesome.
So if you have pain, come and see us.
I love it. Awesome. Ladies, this has been just wonderful. I love it. I love y'all's heart for serving people, and which is what I love about anybody. And I love that y'all just educated me and the audience on what craniosacral therapy is. And hey, if you guys have some pain, please reach out to these two wonderful ladies. They would love to help you. So thank y'all so much for being on the podcast.
Thank you, Jeremy.
Thanks for having us.
Awesome.